subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. If you saw the montage just now, you would have seen the image of our guest today, Dr. Aditya Agrawal, and I'm delighted to welcome him here. This is the 10th time that he has been there with us at the Health Live webinars. He's a regular writer on Seniors Today in the magazine. The latest issue has an article by him on vaccinations. He's going to be writing something again for the magazine next month and for the website. Let me introduce Dr. Agrawal. Dr. Agrawal is a leading consultant pulmonologist attached to various hospitals in Mumbai, notably the Beach Candy Hospital, Bombay Hospital, and the Bhabha Hospital. He's extensively trained in respiratory diseases, both in India and the US. His special interests are in difficult to treat cough, asthma, bronchitis, and lung fibrosis, and runs a specialized clinic for patients with chronic cough. He's a dedicated researcher and a peer influencer in the management of respiratory diseases. Today, we've invited Dr. Agrawal to speak about, and this is a topic that we invite him every year around this time, to speak about respiratory care given weather changes and pollution. We know we are at this time of the year when there are issues with people have, especially seniors have, with respiratory issues, respiratory illnesses, and the weather, of course, is as they say, gets a little naughty. Plus the pollution levels, thanks to in specific areas of the country, and including cities like Mumbai and Pune, the AQIs are very high. And of course, in Delhi, it really gets very bad thanks to stubble burning as well as firecrackers. So, given all of this, we've invited Dr. Agrawal to be here for the 10th time that he is there at this with our Health Live sessions. And thank you very much, Dr. Agrawal. How are you?
I'm doing very well. Thank you so much. It's a pleasure to come back to Seniors Today, because what I actually look forward to every time when I come here is the questions which the seniors ask me. And even today, I would love the seniors to ask me questions. In keeping with the theme of Diwali, keeping in with the theme of the months of October, November, when a lot of things change, monsoons recede, the winters upon us, let's call it autumn for whatever it is worth. Different parts of the country have different problems. You're seeing changing air temperature across the country. You're seeing a lot of air pollution increasing, especially with stubble burning in northern parts of the country. A lot of construction activities which are on full bloom in large metro cities across the country. So again, respiratory health is taking a big beating with this changing environment. And today I'm going to speak about it. What we need to understand is how vulnerable are we, and who are the ones who are more vulnerable? Which adults or which elderly patients are going to be more vulnerable than the other? And how aging and pre-existing conditions increase to sensitivity to environmental changes. So what does pollution do to your respiratory health? What we need to understand is the two types of air pollution, different types of air pollution that we have, whether we are talking about different chemicals, different gases. Are we talking about particulate matter? Particulate matter means particles in the air of varying sizes. And how do they affect your lungs in the short term and in the long term? So when we speak about vulnerability, so elderly patients who have pre-existing medical conditions such as asthma, who are more prone to allergies, elderly patients who have had history of cardiovascular disease are more prone to respiratory illnesses because of the changing weather and because of the changing air pollution. And as we age, the effect of this air pollution on lung health keeps worsening. Now, when we speak about the different kinds of air pollution or sources of air pollution, we are speaking about exhaust from cars and motor vehicles. We are speaking about pollution from transportation, dust and construction, industrial waste, and now what another thing is the urban problem, that is waste burning. A little bit of it is also a rural problem with stubble burning. And most importantly, domestic cooking, the use of wood as a medium to cook food, which is fast dwindling, especially with the policy changes made by the current government. Now, when I speak about air pollution, what am I looking at? I'm looking at sources, different types of gases which are coming from natural sources, such as volcanoes, landslides, etc. I'm looking at motor vehicle associated lung pollution. I'm looking at stationary sources of pollution, such as factories. And then I'm looking at secondary pollutants, such as rain, which when mixed with different gases causes more pollution. Now, when I speak about air pollution, as I explained to you earlier, two parts, particulate matter and gaseous matter. Now, gaseous matter, the most important pollution at the level of the ground is ozone. And as we rise, the different gases would include nitrogen dioxide, etc. And another important rather two important gases which we should consider as extremely toxic are carbon monoxide and volatile organic compounds, which are the most important air pollutants inside your homes and offices. Carbon monoxide is usually produced when, within poorly ventilated homes, you are having a fire lit. Now, with Diwali coming, if you don't have good ventilation and you are lighting diyas, etc., you run a risk of having carbon monoxide accumulating in the home. So make sure that you have enough ventilation when you're lighting diyas and candles. The other important chemicals, gaseous matter, is volatile organic compounds, which are usually secreted by different paints. And it's extremely important to understand that they result in significant respiratory illnesses. Now, as we speak about particulate matter, the particulate matter which matter the most are the ones which are fine particulate matter of a size of less than 2.5 micrometer. The ultrafine particles are the ones which can reach the deepest corners of your lung and even be absorbed into the blood. And the coarser particulate matter are the ones which are filtered off by your nasal hair, by your upper respiratory tract, and the lung in all. So what are the health effects of air pollution? Short-term effects include headache, coughing, sometimes respiratory infections such as pneumonia, sinusitis, etc. It can result in inflammation, reddening, and swelling of your breathing tubes called the bronchi, which is called bronchitis, and it can cause irritation of the skin and cause skin allergies. The long-term effects of air pollution on human health include effects on the central nervous system, that is your brain. It can worsen, aggravate your cardiovascular diseases, your heart diseases, respiratory diseases. Yes, we all know about it. It worsens your risk for asthma attacks, COPD attacks. It can result in worsening of your lung fibrosis. And long-term effect of air pollution that everybody needs to understand is it shortens your lifespan. Now, when I speak about particulate matter, what happens is the particulate matter of size 10 micrometer gets filtered in the upper respiratory tract. Particulate matter of size 2.5 microns reaches your lower respiratory tract, and the particulate matter of less than 1 micrometer reaches the deepest corners of your lung called the alveoli. Now, how do they affect? Now, the particulate matter which affect the most are the ones which are of size 2.5 microns. They cause attacks of asthma, bronchiolitis. They cause inflammation and swelling inside the lungs. And the ones which are even smaller can cause pneumonias, and they can impede your lung function and hence growth. Now, when we speak about air pollution, different ages have different effects on their health. Pregnancy, I will speak about pregnancy, the effects of air pollution on pregnancy in the next slide. Children. The children are the most vulnerable group apart from the elderly. Children can develop asthma. They have slowed down development of lung function, and hence there is growth retardation. They may have developmental problems and they have delayed milestones. More wheezing and cough results in fewer days of attending school, more absenteeisms, and thus results in decreased scholastic activities. It also results in a starting of the process of atherosclerosis, which is hardening of the arteries in the body. In adults, again, it results in asthma attacks. It can cause heart disease, which is basically blockage of the arteries. It can result in other vascular diseases such as stroke. It can cause lung cancer. It can cause something called COPD, or chronic obstructive pulmonary disease, where there is permanent constriction of the tubes of breathing, which results in air not allowed to come out of the lung easily, and it can also result in early diabetes. Elderly who are as vulnerable as children can again have increased or worsening attacks of asthma and COPD. Pollution can result in decreasing or accelerating the decline in lung function, which is already happening with age. Air pollution is known to cause lung cancer, and it also can result in dementia. Now, when we speak about pregnancy and pollution-related health effects, why is it important when I speak about pregnancy and pollution in a meeting with elderly? Because all elderly here are grandparents or parents with children who are going to expect their children. So why should you protect your children who are pregnant or are going to get pregnant from pollution? Because exposure to pollution has resulted in prenatal, that means before birth, and childhood neurological problems such as reduced brain development. It slows down the process of aging or rather development. It can cause attention deficit and hyperactivity disorder, that is ADHD symptoms, where a child becomes more and more aggressive. Pregnancy associated air pollution can result in lowered birth weight, and low birth weight is associated with reduced or slowed down development of the vital organs in the body. Women who are exposed to high levels of particulate matter of size 2.5 micron may end up having twice the risk of having a child with autism. And women who are exposed to this same particulate matter in the second and third trimester of pregnancy may see that the children have high blood pressure when they grow up. Now, when we speak about this weather, we need to speak about how fluctuation in the weather can affect your respiratory health. How does weather change, temperature change, humidity change, and extremes of weather aggravate respiratory illnesses? And what is the effect of temperature inversion on pollution? So what we need to understand is when there is a climate change, there are warmer and shorter winters. There is a higher risk of exposure to viruses. Whereas when you have longer winters and colder winters, there is a higher risk of virus transmission. The reverse is when you have good weather, short winters, less viral transmission, reduced respiratory illnesses, and this reduces the morbidity, that is illness and death from viral diseases, thus improving respiratory health. Climate change is known to cause several 100,000 deaths per year because of respiratory illnesses. I'm giving you 5-year-old data which said that you had a 160% increase in the incidence of death from cancers of the respiratory system vis-a-vis 1990. We had a 12% increase in deaths from lower respiratory tract infections, that means pneumonia, when you compare to 1990. And there's almost a 100% increase in the number of deaths because of COPD, or chronic obstructive pulmonary disease, since 1990. Now, how do humidity and wind play a role? Now, with increased humidity, you have increased risk of viral transmission, increased risk of respiratory infection. Humidity and wind both play a role in transmission of the viral illnesses which affect the lung. Now, I'm going to speak about temperature inversion. So what we need to understand is warm air rises up and cold air comes down towards the ground. So during the summers, the warm air rises up, and with it, the pollutants rise up in the higher stratosphere of the atmosphere. Whereas with colder air or colder weather, the cold air stays more towards the bottom, towards the ground, thus trapping the pollutants close to the ground where humans breathe. So this results in increased risk of pollution-associated respiratory diseases. Now, what are the symptoms that we need to watch for? And when do we seek help? The key warning signs are somebody who has a chronic cough or a cough which is lasting more than 8 weeks, somebody who is wheezing, which is a whistling sound in the chest, or has chest tightness, or has severe breathlessness such that they cannot move about in the home without feeling breathless, need to be in a hospital seeing a doctor. And it is important to intervene early and consult a respiratory physician as soon as possible. Now, pollution can cause several effects. It can cause breathing difficulty, it can cause nasal allergies, it can cause your nose to be runny, it can cause inflammatory lung disease where there is swelling and obstruction in the tubes of your lung. Pollution can result in headaches and leaves you constantly tired. Air pollution is known to cause conjunctivitis and severe eye irritation, and can often result in nausea and vomiting, leaving you dizzy. And chronic cough is one of the most important symptoms of a patient who is exposed to air pollution. Now, what are the strategies that you and I can adopt to reduce air pollution and to protect our respiratory system? Indoor air quality using air purifiers, maintaining the humidity levels, and avoiding indoor pollutants is the foremost step that you and I should take to reduce to protect our respiratory system. Outdoor precautions: be more conscientious citizens. Check the air quality index before leaving home. Use masks and time your outdoor activities to the time when there is the lowest amount of pollution, while being more conscientious and contributing less to adding to pollution. What are the healthy habits that you and I should adopt for stronger or healthier lungs? If you are a smoker, quit smoking. If you are somebody who is exposed to smoke, secondhand smoke, make sure the person who's smoking quits smoking. Reduce the exposure to smoke of any kind. Exercise every day. Walking, yoga, and deep breathing are simple steps that you can take to increase your lung capacity. Dietary support is use or rather consumption of antioxidant-rich foods and a very good amount of hydration, which would mean about 50 to 60 ml of water per kilo body weight. But remember that with elderly patients, you may be on fluid restriction because of existing heart conditions. check with your doctor before you increase hydration unless they support it. Now, the nature step to respiratory health: reduce air pollution, quit smoking, plant lots of trees, eat lots of fresh seasonal fruits and berries to increase your antioxidant in the body, encourage indoor activities, avoid outdoor activities during times of high pollution, check your immune balance, make sure that you are healthy before you start exercising. Now, seasonal preparedness is extremely important, and there are precautions for each season. And another important thing that you can do is to vaccinate yourself to prevent respiratory illnesses. So, one important activity that we can all do is to limit the exposure of children and elderly to air pollution. So, do not head out of the home very early in the morning, that is between 4 and 6, for a walk. Try starting your day a little later. Then use of technology such as air purifiers and air filters help in reducing your exposure to pollution. Maintain and improve your homes, office buildings, school buildings, etc. Reduce the quantity of, or rather, reduce the number of times you are doing home renovation. There should be a policy regulation which we are having now for limiting the environmental pollution. Planting trees helps in reducing air pollution by acting like a physical barrier. It also helps in improving your, or rather increasing the amount of oxygen in the surrounding. Now, other mitigation strategies: air purifiers, ventilate home well, and use clean fuels and stoves. That means use of LPG should be encouraged. Effect modifiers, healthy food, quitting smoking, and early intervention by a doctor helps in mitigating or reducing the effects of on respiratory health by air pollution. Using barriers such as face masks, active transport such as bicycling, planting trees helps in, or rather using routes of to your work with lower air pollution help in reducing the exposure to air pollution. Plan exercise at the right time and check your local air forecast before leaving for work. Breathing exercises are extremely important, and what should be remembered are diaphragmatic exercises and pursed lip breathing, because air pollution results in obstruction of the tubes of breathing, that is bronchi. When you're doing diaphragmatic exercise and pursed lip breathing, you're actually allowing the lungs to empty out so that the next breath you take in will have sufficient oxygen as per your body's need. How do these exercises improve oxygen flow and reduce breathlessness? As I was explaining earlier, air pollution causes bronchitis, tubes get constricted. Because of constriction, air that you breathe in stays inside the lung. Now, to remove all the excess air which is stuck inside the lung, you need to do these exercises to help gradually remove them during exhalation, such that when you take the next breath, you can take a larger quantity of air into your lung. The last slide, medication and device tips. So if you are asthmatic or have a disease called COPD, ensure that your doctor chooses the right kind of inhalers, or if you can't use inhalers well, use a nebulizer. Always use an inhaler with a spacer, because inhalers can sometimes be very difficult to use. And follow the medication schedule as per your doctor's prescription. And if you do not understand, recheck with your doctors. Now, recognizing emergency situations is important, because very often we have patients coming in extremely late when they have breathlessness. So when you have breathlessness, call for help at the very onset and do not wait for it to subside. If you are very sick, do not wait for a doctor to come home. Head out to the hospital and ask your doctor to see you in the hospital. Importance of having emergency contacts and access to healthcare resources, such as your family physician and your pulmonologist, is extremely important. Now, when we speak about air quality, it's extremely important that we all check air quality during the winter. And there are several resources for that. And there should be tips for using technology to remind, monitor, and report respiratory health, such as the iWatch, which has a very good reporting system for respiratory health. Now, air quality index actually monitors a few parameters. One, it checks the quantity of particulate matter of size 2.5 micron and less. It checks the temperature and it checks the air humidity, which all affect the respiratory health. So the only solution that we have for improving our respiratory health affected by pollution is to be creating less pollution. And I hope we all can join hands to do that. I'll be open for questions now, please.
Thank you very much. Thank you very much, Dr. Agrawal, for an amazing presentation. I've gotten some questions here. As always, all of you, the edited video of this session will be there on our website. So those of you who would like to see Dr. Agrawal's presentation once again can do that by coming on Seniors Today, the website, on Monday evening, and you will get to see the presentation as well as an edited takeaway of the session. So you can do that, but please do send your questions, and do remember that the sessions like this is always advisory in nature, and those of you who do have some major issues to attend that need to be attended to, please do refer to a medical practitioner. And of course, you can also access Dr. Agrawal at his clinics in Mumbai. So, Doctor, we have a question that has come in from on my SMS, which is, Doctor, you mentioned about Diwali and the festivities that are there. What are, he says that I just cannot do without having the diyas, and even if I have, got rid of crackers altogether. What are diyas also? Are lighting of diyas also harmful?
Well, anything in excess is harmful. So if you are lighting diyas at home, I would encourage you to do that. Please do that. Do not skip upon small pleasures in life. But when you do that, ensure that your home is well ventilated, because when you have toxic buildup of the gases from a burning diya, it can affect your respiratory health. But if you have good ventilation, you will have reduced poor quality of air in your home.
Right. Okay. So this person has said, Doctor, but if we do ventilation, the smell and the fumes of the crackers comes in.
Well, I think when you speak about this, you need to encourage your entire society. It is not just your home, your family, your building, your neighbors. It is society at large, which should now move away from buying firecrackers as individuals. If there is a need for a fireworks show, it should be a communal one where the whole city joins together in watching the fireworks.
Yeah, unfortunately, that does happen. You do have community shows, but they haven't really taken off in right earnest. But yes, I agree with you, and I've also seen very successfully, and especially abroad, where you have lasers replacing the fireworks. So lasers are there, and there's a sound and light show thanks to lasers. Doctor, I have a question which has come in. Doctor, are respiratory diseases hereditary in nature? Because my parents had it. I did not have it for a while, but now I have started feeling that I need attention.
Yes, you are correct. There are some respiratory conditions which are hereditary. One example is allergies. Another example is asthma, which is a kind of allergy, which are usually hereditary. There are few conditions such as which can result in early onset of COPD, which are heritable from one generation to another. So, in a way, yes, respiratory illnesses can be hereditary and they may not be. So, again, if infections are not hereditary, but allergies are.
Right. We have a question from Rosa Kurela, who asks, if I talk loudly, then it seems I'm unable to breathe well. What is the reason? After 10 minutes, I will be normal. Why does it happen?
Well, this is a very important question. So, it's not just loud talking, it is also when you are eating, you feel short of breath. The reason for this is twofold. One, because you may have nasal blockage, which results in you not being able to breathe with your mouth when you are speaking. Second, when you have neuromuscular weakness or muscle weakness, you can have severe breathlessness when you're talking loudly.
Right. Uh, Doctor, we have a question from Dolly Jaiswal, who asks, after COVID, I'm facing problems of short breathing. Is there a way out?
Uh, who was this? Who asked this question? I'm sorry.
This is Dolly Jaiswal.
Mrs. Jaiswal, it's a very specific question. I don't know the details of your respiratory health at the moment. I could answer your questions if I understand a little more about your COVID and post-COVID status. We could speak about it later.
Right. Uh, Another question that she's asked is, are there any side effects of these vaccinations?
Well, if you are allergic to egg, then you should avoid taking the flu vaccine. The pneumococcal vaccines or the vaccines against the bacteria called Streptococcus pneumoniae usually have few side effects. One effect is that they may result in fever, but if they do cause fever, we are happy because that results in higher amount of antibody production. Post vaccination, if you develop fever, I would recommend that you avoid taking uh, fever medicines, antipyretics. Allow the body to produce more antibodies so that when the body can, the vaccine is more effective.
Right. Doctor, there's a question from Seema Chaturvedi, who says, I had sleep apnea. I was using a BiPAP while sleeping, but sometimes even after using it, I feel suffocated. What should I do?
Well, suffocation is one of the most common side effects or other effects of using a BiPAP machine. What you should actually check upon is one, is your mask correct? Is the pressure that you're using currently correct for your sleep apnea? Do you need to revise the pressures at which your BiPAP is set? Other important thing is, do you have a dry mouth for which you may use humidifiers, or if you're suffocated, you may have a wrong size mask or the wrong kind of a mask. Another important thing is if you have nasal obstruction and you're using a nasal mask, you may end up having leakage of the pressure and hence failure of treatment of sleep apnea with the BiPAP. So I would recommend that you see your pulmonologist, your lung doctor who prescribed you the sleep apnea sleep apnea test and the following treatment to assess why you are failing therapy.
We have a question from Shobhaji. The question is, in Delhi, given the air quality is very bad, and breathing and pranayam are suggested in open air, what should one do?
Well, Delhi air quality is extremely poor with very high levels of particulate matter and noxious gases. Uh, I would recommend that if you can, try exercising more indoors during the winter and less on the outside.
Right. Uh, Here's a question from Anita ji, who asks, our elders used to say that lighting ghee diyas cleanses the environment. What is your take on that?
You stumped me actually. Uh, Ghee diyas or any kind of hydrocarbons, when lit, break up into the same gases. It Whether you're using wood or you're using ghee or oil or any other medium, they all result in production of high levels of carbon dioxide and the different particulate matters. And I don't think a ghee diya is any more beneficial than a oil diya. What is important is that you dilute the concentration of the pollutants by having good ventilation in your home when you light such diyas.
Right. Thank you. We have a question from Sunita Verma. She asks, can endoscopy lead to lung infection in a person with low immunity?
Uh, Endoscopy is a very broad spectrum. Is it lung endoscopy or talking about
Not mentioned.
stomach
Not mentioned.
stomach endoscopy? So usually no, endoscopy will not result in lung infections.
All right. Um, one question, last question. I think there are a few questions, but doctors already responded to that. But one question from Mr. Anil Singh: can one get sick from because of pollution? And can we say premature death can be mainly attributed to air pollution?
Yes, air pollution causes a significant amount of disease, illnesses, and it can result in premature death in multiple ways. Increased pollution, increased respiratory dysfunction, increased risk for infections, increased risk for respiratory failure can all result in premature death. Another important thing is air pollution increases the risk of cardiovascular disease, and we often find that because of pollution, there is a cardiovascular disease associated with death. So premature deaths are common in patients who are exposed to high levels of pollution. I see another question here. Some Mrs. Naina Somaya has asked, is bronchitis a result of air pollution or viral infection? Now, bronchitis is a very broad term, which basically means the tubes in the lung called the bronchi, which are hollow tubes which take air from your nose or mouth to the deepest corners of your lung, are inflamed, and they have swelling. So basically, what happens is because of the swelling, uh, the amount of air which is passing through reduces. I'll just give you an example of what bronchitis means. This is a tube through which air can pass through. Whereas in this tube, there is significant swelling.
Right. Right.
Significant swelling. See the difference between the two tubes? The one on your left, the purple tube is a healthy tube. The bronchitis tube is on your right, the red one. You see, where
Yeah.
will more air pass through? The one through the purple tube, correct?
Yeah. Yeah. Yeah.
So this is what bronchitis is.
So how can one get to see what the tubes are like in one's body?
Well, you do not look at these tubes directly under naked eye with your eyes unless you're doing unless I am doing an endoscopy for reasons other than pollution associated illness. What we do is we do something called a lung function test or spirometry, where
Right.
we check the flow of air across these tubes. In bronchitis, as I was explaining earlier, air goes in but doesn't come out as effectively. So you see that the flow of air outside of the lung is slowed down, and that is called obstructive airway disease. Two common obstructive airway diseases are asthma and COPD.
Right. Doctor, one last question before we end is: are there any exercises? Your presentation was detailed, and you've obviously responded to most of the questions here. But as an end note, how does Dr. Aditya Agrawal take care of himself, and of course your family? Your father is a very well-known doctor, and how do people take care? How do doctors take care of yourselves in this thing? Because you all have a very stressful life. You all are living in the same city as the rest of the world are, and there are doctors in Bombay, Pune, Delhi, everywhere. What do you do to take care of yourself, given the vagaries of the weather?
Well, there are some things which are not modifiable, such as the weather. But what you can do is switch your exercises from outdoors to indoors during the winters when the pollution levels are higher. Second thing is exercise daily. Maintain a good cardiovascular exercise regime. And I would encourage everybody to also start doing resistance training and increase their muscle strength. Reduce air pollution inside your home, which is the most important thing, by reducing the use of volatile or aerosols. Avoid the use of air fresheners. Avoid the use of incense at home. Though it's Diwali, try minimizing the number of diyas and candles. You could use lights, which are a little more eco-friendly. Brighten, like as Mr. Maheshwari was talking about, switch over from firecrackers to lasers and lights. Other important thing is hydration. Ensure that you're well hydrated through the winter. Hydration significantly improves respiratory health. And why is it important is because, in a simple example, when you go to a very cold place and you're not very well hydrated, the secretions in your nose dry up, and you realize that your nose may start bleeding because of poor respiratory health. The same thing goes on into your lung. So if you have good hydration, what happens is the lung, the cilia, or rather the hair-like structures inside the lung will keep moving and pushing the pollutants out of your lung and maintain good respiratory health. It also pushes the bacteria and viruses outwards.
Right. Thank you very much, Doctor, for an amazing presentation. I know there are several questions that are there which we're not able to answer because we're running out of time. But thank you once again, Dr. Aditya Agrawal, for being here. This is, for being there always whenever we wanted you. I remember, when we started our health webinar series, there were so many questions about COVID, and you have been there. You've been writing very regularly for our magazine. So thank you for being a friend of Seniors Today. And to all of you here, wish you a very happy Diwali. Do remember that we do not have a session next Saturday. We do not have a session next Saturday, which is November 2nd, but we will be back once again on a Saturday at 5 p.m. from November 9th onwards for our health webinar series. So be there 5 p.m. and have a great Diwali. All of you, do enjoy yourself, do enjoy responsibly. And as Dr. Aditya Agrawal has said, obviously have the festivities, but do ensure that your health is under check and you take all the precautions that he has recommended. Thank you very much, Dr. Aditya Agrawal, for this session, and all of you there, please enjoy yourself and wish you a very, very happy Diwali.
Thank you so much, and happy Diwali to all.
Subscribe now and press the bell icon. Never miss an update.